everyone, and welcome back to another episode of the Fourth Wave in Therapy podcast. I'm so excited today to have a long-term, I'm going to say friend and colleague now, Dr. Larry Burk. Larry, thank you for joining us.
Glad to be here. It's a long way on the other side of the globe here, and I'm gonna move one picture back here because I know it's very, very bright right now. So I'm gonna turn this down.
You're very welcome.
Yes, and I have my other typical props in my office here. I have my Yoda sitting on my paper shredder.
I love it, the wise one, looking over us as we chat.
Well, he's there to remind my clients not to say the word try.
Try.
Because remember from Star Wars, it was there is no try, only do or do not. So
they do or do not. Let's keep that in mind. I'm going to introduce you, Larry, to anyone that might be new to your world. So Larry now is retired, a holistic musculoskeletal radiologist who works in an online health coach kind of setting now. He's trained in hypnosis, medical school training, of course, in radiology at the University of Pittsburgh and then University of Pennsylvania. Associate Professor of Radiology and Head of the Musculoskeletal Section at Duke University. And I got to visit Duke some years back. Such a beautiful campus. If anything, it reminded me of Hogwarts, the Harry Potter. It just had that kind of feature, all the buildings. It was just stunning. It was amazing. You were the co-founder and executive education director of the Duke Integrative Medicine Unit and introduced at UCLA acupuncture for physicians. Now, Larry and my world have crossed because of EFT, of course. You learnt it in 2002 and began using it at Duke Integrative Medicine. Your mentors are Carol Look, of course, the great Carol Look, and Margaret Lynch-Rainier, who, of course, is another wonderful giant in the EFT world. Larry has many books. We've actually got them below, so you can actually go and access them. One of them that I thought was absolutely fascinating was about dreams, and particularly dreams that can save your life, and women in that talking about their dreams of breast cancer diagnosis that were absolutely accurate. But today, the topic that we're going to unpack in this fourth wave is about the mind-body interaction and emotions in a certain area of the body, and this area of the body is the shoulders, and certainly frozen shoulder as a condition. The reason why we're chatting about this is Larry has a brand new book out, and we have the details for that below as well, so that you can go and explore that ebook if this topic is of interest. But Larry, maybe can we start with that whole kind of concept and topic of you've come from a medical background, yet really approach the body from a very holistic point of view in terms of emotion and where it's stored in the body. And I know we'll get into things like frozen shoulder and the emotions there, but at what point in your career did this come into your world, or did you go and explore emotion in the body?
Yeah, I think I was on a pretty straight and narrow path during medical school, and it wasn't until almost at the end of residency when I woke up one day with shoulder pain, and there was no injury on that, and that was my left shoulder, and it went on to have continuing pain. Now, that was not a frozen shoulder. That was so-called impingement syndrome, which I was studying at the time because I was doing the early research on MRI of the shoulder, and that was a hot topic. And it didn't get better for months and months and months. And one of the surgeons and one of the things I did, one of the surgeons I went to put me on a very powerful NSAID, which was Indocin at the time, which is indomethacin. And I was popping those in one week, one after another, and then I started getting ulcers in my mouth, and I could barely shove the pills in, let alone eat anything. And after a week, I kind of thought, oh, wait, maybe that's a side effect from that drug, and I quit taking the mouth ulcers went away, and that's my first real severe side effect from a pharmaceutical. And back then, I knew nothing about the symbolism of any musculoskeletal or other types of symptoms in the body. So I was pretty much clueless as to why it happened. And all I knew at the time was the medical model and the surgical model. And so I talked one of my surgical colleagues into doing an arthroscopy on my shoulder, which was the emerging new hot intervention at the time. And that was one of the stupidest things I've ever done, So he went in, and I did an MRI scan of my shoulder before I had no clue what I was looking at. It was the first MRI of the shoulder I'd ever seen, and there was nothing in the literature. And so he did the scope, removed my bursa. I had bursitis, and I just, no rotator cuff tear. And then he shaved off the underside of my acromion. So he modified my anatomy, and that was the theory at the time, that was what was causing the impingement when you lift your shoulder up. And I recovered from the surgery, and my shoulder pain didn't go away.
Oh.
And it didn't go away. I finally went through intense physical therapy. That, didn't help. I got injections. And that went on from 1984 to 2004, 20 years. Okay.
Are you serious?
And I was hampered. I did every acupuncture, everything I could think of. And then finally, at the end of that period, my first marriage broke up, and my shoulder started getting better. So,
wow.
By that time, I had learned EFT. I had done a lot of acupuncture myself, and I had come to realize that there might be a somatic metaphor stuck in my shoulder, and it was repressed anger from my first marriage that I'd been repressing for decades. And so my left shoulder finally started to recover, and that was, I had like a breakthrough and changed jobs, got divorced, and all these things happened. And then like 2 or 3 years later, my right shoulder started to hurt. And by this time, I'd already been doing EFT for a few years, and I was doing acupuncture in the clinic at Duke, and I was applying my hypnosis skills, and I had one patient with a frozen shoulder. And I asked, and knowing with my EFT training, I said, well, did anything happen the week before your shoulder started to hurt? And she said, no, and that was 6 months ago. She didn't remember, and she was a hospital pharmacist, and she had taken all those drugs, and they didn't help, and they made her constipated. It was just like, she knew enough that as a pharmacist that she was having side effects. So she was real frustrated, and I just did the acupuncture the first visit. There was nothing to tap on. She didn't remember anything, and the next week she came back, did more acupuncture, but I asked her, she goes, oh yeah, I remembered my best friend, just up and moved away, didn't say goodbye. I haven't heard from her since. I've been angry about that ever since. And I said, whoa, there we have the clue, and then we did some tapping, and I was doing a special kind of acupuncture at the time, which was one of my mentors out in British Columbia, Michael Greenwood, that taught. He was the first guy to introduce me to the concept that it might be a psychosomatic issue. And sure enough, this very simple acupuncture, you put one needle in between the thumb and forefinger on either hand, put one on in between the second and third toes, and you stimulate them vigorously. Ordinarily, you kind of want to be gentle with an acupuncture, but and the patient goes, ah, and you say, oh, good, just keep breathing. And you have them hyperventilate and go into an altered state. And the chi really starts to flow. And this woman's hands started to shake. And I had 2 medical students with me at the time. And they were watching this, and they're going like, oh, what's going on here? And the woman was going, she knew something was happening. And I knew it was like an energetic healing release. I told the medical students, just watch. And at the end of the session, she was starting to move her arm up and improve her range of motion. And she said later when I talked to her, we did a couple more sessions. That was like a turning point in her whole life, and she still talks about it to friends, 20 years later. And so that was my turning point. But then when I got the frozen shoulder 2 years after that, I knew what was going on. And I go, oh no, this could last for months. And I was desperate. And I was doing but I was doing superficial EFT. I was doing, and sometimes that works. I was just, my shoulder's really angry. I'm really angry. And at the time I was angry about American politics. So I was ranting and raving and tapping, but it wasn't quite, getting there. And all I had been doing when it started was a little gentle yoga, just gentle yoga, not much else, but I could feel first the pain comes on, and then a few days later, the range of motion starts to diminish. And I knew it. I said, oh my God, I can't, and they're not that common in men, but I said, I'm getting it, and so I called my medical intuitive friend, who's the psychic who's done readings for me over the years. And I said, I think I've got a frozen shoulder. I wanted her to do energy healing on me. So I get into the office thinking I'm going to get energy healing. She goes, would you like to know about your past lives related to this shoulder problem?
Oh, wow.
I said, well, yeah, why not? And she goes, you were stoned and poisoned in the dark ages for your righteous anger at unjust authority figures. You want to do that in this lifetime? And I'm like, okay, no. So I went deeper with the tapping into, not only was I tapping on the angry at the American politics, but I was angry at the Spanish Inquisition. And I was like, oh, and my shoulder started getting better. And I was better within 3 months, which sometimes it lasts for, 2 or 3 years, which is brutal. And the people on my Facebook group, I do run this frozen shoulder healing group on Facebook, they're just furious about being frozen. But very few of them make the connection that maybe I was angry before it started to freeze. So that's been my main message on this group, and also in the book, is to get the word out. And thank you for your contribution to that process. It's been a wild journey.
Yeah, and I often think lots of these things do start with our own experience in the beginning, don't they? We get some, and then the connections, and we see that then as a common and that's what's coming to mind for me. Is anger the most common emotion in shoulder issues? Is that what you're coming back to, or is there something?
That's
even
what in my experience, that's been. But other people on the group will say, well, no. When I point out it's an emotional, they say, well, it was really grief for me, and any kind of emotional burden could manifest like that. And if you think about it from the chakra point of view, it's probably most likely a combination of the second chakra, which is usually about anger, and the fourth chakra, which is about grief. So it might be those two chakra imbalances combined. And I think, and the thing that's so amazing for me as a radiologist about frozen shoulder is, there are a lot of psychosomatic illnesses out there. The big one that everyone thinks about is fibromyalgia, which is clearly a trauma-related, problem. And they get trigger points all over their body, and many of them have a trauma history with a high ACE score. But when you do an MRI scan on those people, you see nothing. Their muscles are all normal, their joints are all normal, their spine's normal most times. But when you do an MRI of the shoulder in someone with frozen shoulder, their synovial lining of the joint is inflamed, and when they go in and do an arthroscopy, guess what? The normally pink lining of your joint is angry red. It's the ultimate somatic metaphor. You can see it. You can. That to me is why it's. And the only research paper that's been done on it was by Dawson Church, and unfortunately, it was a very short trial. He did one session of EFT. And the pain and psychological things improved, but he did not measure the range of motion, which would have been, over a couple of weeks. That would have been marvelous. So that study still needs to be done, and I've, hoping to be able to do that someday.
That'd be brilliant, because it is common, like people talking about shoulder issues or, the aging process and things like that as well. And sometimes it just gets put down to that more so than emotions or, some sort of psychosomatic kind of response. Is it common? Like, do you see it? I know you're running a group specially for this type of topic, but in your practice at large, when you were actually working, was it really common? Like, how common is?
Well, when I was doing just regular radiology, you would see a possible frozen shoulder case every day or every other day, but you got to realize that they don't get an MRI scan to diagnose frozen shoulder. That's diagnosed by the clinical history, and you ask the woman, can you unbutton your bra strap or not? And the diagnosis is made if you cannot get your hand above your belt behind your back, you have it. And for men, obviously, but there's something called the Apley scratch test, where you put your thumb behind your back and you see how far up you can reach. You should go the whole way up between your shoulder blades, and that's normal. And so you just compare one side to the other, and so that's also when I love looking at different systems of symbolism. We already talked about chakras. The 5 elements is in there as well, and the 5 elements, anger is associated with the liver, and sometimes gallbladder problems manifest as shoulder pain, but the other more popular New Age one is Louise Hay, and I've used her Heal Your Body book for decades. And when you look up shoulder pain, not frozen shoulder, just shoulder pain in general, she's got a phrase for everything, and her affirmation is, shoulders are meant for bearing joy, not burdens. I mean, and her book, as a physician, you read that book the first time, you think this is bullshit. It's like, but then you realize there's a nugget of truth in every one of her intuitive impressions. So.
Yeah. And is that concept then of perhaps what are you carrying around in life when the pain started, or is there a period of time beforehand that might not be connected?
It's usually it might be simmering for a month or so, but it's that week before that when something happens it's like pushes you over the edge and triggers that inflammatory process. Because prior to that you might be aware that you're carrying something there, and they do talk about 4 stages of frozen shoulder. The first stage is where this acute pain and you can't move because it hurts so much. But what they do, sometimes, if to the extreme example, they'll put someone under anesthesia and test their shoulder to see if it just hurts or if the motion is restricted. So stage 1, it hurts a lot, but if they anesthetize the shoulder, you have a full range of motion. Stage 2, it hurts a lot, and when they anesthetize it, you can't quite move it. And then stage 3, that's when you have Tyrannosaurus Rex disease, which is, think about it, the little picture of T-Rex with the short little arms. That's pretty much it. You can't comb your hair. You're lucky if you can brush your teeth, and it's maddening. And unfortunately, it's also very difficult to sleep, to find a comfortable place to sleep. So people are just really distraught. The good news, the only good news, is that it usually only lasts for a year or 2 and eventually resolves on its own. But the suffering that goes on for the couple of years is horrendous. And then the really bad news is a third of the time it comes back in the other shoulder, and that's brutal.
Wow.
When people know, oh no, and it might be just shortly after the other one healed. Yeah. And my hypothesis about that is they've never dealt with the unresolved emotional issues, and it's going to predispose them to coming back. I don't have any proof of that, but I'm suggesting if you do the emotional work the first time through, maybe it's not going to come back the second time.
And you've talked about not just the chakras and acupuncture in there, but also EFT or tapping. Are there any modalities, I guess, that, if anyone wants to go off and explore based on shoulders or, even other parts of the body, that you've found highly effective? I know EFT for both of us has, a bit of a passion, but any other modalities to help process these?
Yeah, I took a course at Duke Integrated Medicine about 5 years ago on expressive writing, which is just a wonderful, simple technique. And I don't know if it's considered mainstream psychology or not. Is it? I mean, it's evidence-based,
Yeah, and absolutely. We might call it journaling sometimes. Sometimes we do alternative hand journaling. So we do teach that in psychology now, where even our students in class as a practice will journal with the opposite hand, non-dominant hand. So you're absolutely right. Expressive writing has been studied, and it is something that is recommended even in mainstream kind of approaches.
Yeah, I mean, James Pennybaker is the guy who did all the research on it, and dozens and dozens of articles. But the distinction I make between journaling, which I have people do with keeping a dream diary, you want to keep a record of that. But in expressive writing, the way I was taught, you don't want to keep a record of it. You want to get it on the page and then destroy it. Either burn it or shred it, or put it under Yoda in this paper shredder. And I do tell people that if they're dealing with someone who's still alive, I usually recommend shredding, or you can write like a rough draft of a letter to someone and then not send it, just shred it. Someone who's died, I do recommend burning it, because the metaphor is the smoke is taking the message up to heaven, So that works pretty well. But yeah, I said the guidelines are just write emotionally. Grammar doesn't matter. And I usually just recommend 5 minutes. Just fill one side of a page. And then when you're done, go back and circle the highlighted words that have the most charge on them. And then that's what you could use to set up your EFT. I say, before you destroy it, let's do some tapping, and then you can destroy it. And that way, and then after the tapping, of course, I use that computer metaphor, which is every bad thing that ever happens, like a malware program that gets downloaded into your meridian system, uploaded into your brain through your nervous system, and then all that file up there has the picture and a story and this malware program. And all you got to do for the tapping is just find the file name, repeat the the target phrase, to get that program running in a fashion that you can control, and then hit the delete key over and over again and uninstall the program, and then I usually combine it with hypnosis afterwards, and so then you're putting in the new program, and people like that explanation, so I've used it over and over again, and because actually it's based in memory reconsolidation, neurophysiology, so it's actually a real good mechanism for how it actually works.
And it is that act, isn't it, of saying out loud what is happening internally, which actually is the premise of, a lot of, ancient approaches, even in the talk therapy, think back to Freud or, lying on the couch and free association. It's the act of actually saying the truth.
Yeah.
And
naming it. Yeah.
Naming it.
And
yeah.
I also like Gary Craig's three strategies for success is be persistent. You can keep doing it over and over again until it's gone. Be specific, and then the last one is important, is be emphatic. So if you're not getting anywhere, scream or cry when you're doing it, and you'll get the program running. And that's valuable.
Yeah, I love that. We highly promote to our teenagers in therapy, rant and tap, and swearing is allowed in lots of teenage therapy sessions, just so that they can truly get it out.
Oh, yeah, no, it's very important, and then and I do emphasize in the book that it's important to do. I categorize expressive writing and EFT as an anti-inflammatory, remedy. It's like and acupuncture also, and then there are certain remedies you can actually take, like DMSO is a big one, dimethyl sulfoxide, and castor oil are two of the most popular ones. You can even combine them together. Castor oil is a little messy, but and then I don't recommend any non-steroidals. Those things poison your kidneys, poison your liver, and I don't recommend muscle relaxants or any of the other things that even a TENS device does numb the pain, but it doesn't help the inflammation. So, and then the worst thing you can do is go to physical therapy and have some aggressive massage therapist or physical therapist start to work on your shoulder. And I had that happen to me. Oh man, it was excruciating and just made it worse. It just ramps up the inflammation. So, and oral steroids have side effects. One of the go-to things for orthopedic surgeons is just to do an injection of steroids into the shoulder. And that does directly decrease the inflammation. So there's something to be said for that. But steroids anywhere have side effects and can damage your joint and things like that. So, yeah. And then beyond that, there's, more aggressive approaches where you would put someone under anesthesia and then just jerk their shoulder around till you break up and that's brute force. And in surgery, they go in and they strip the lining of your joint out, and it's just, so those are last resorts. And a lot of surgeons are reluctant to do it until people have done 6 months of something else.
And tell me, where do you think the medical field is at with embracing the mind in body, perhaps?
I think in chronic pain itself, there are some inroads being made by people like, it was really started with John Sarno, and his Heal Your Back Pain books back in the 70s at NYU, and he was this legendary physiatrist who people would come from all over the country. Celebrities would come heal their back pain, and he basically said it's all about repressed rage. He just spelled it out there, and none of his NYU colleagues would refer a single patient to him because he didn't do any research. He just had tons and tons of anecdotal case reports. Finally, his proteges, Howard Schubiner and Alan Gordon and a few of these other guys and David Hanskin have been doing research and publishing papers with they're doing fMRIs before and after, and they call it emotional awareness and expression therapy. It's got some Gestalt in there and a few other things, and expressive writing. And they're publishing papers in mainstream journals, Journal of Pain, and showing, hey, it works for fibromyalgia, works for low back pain, and it's a breakthrough in the whole chronic pain realm. I think that's, but yet what we're up against is in the radiology department, I would see it's just an injection factory. It's like people just come in. I used to sit there when I was reading my my scans, I'd be sitting in a room where the nurse was triaging all the injection patients, and they'd be like, oh, no, you have to wait 3 months till your next injection, because, and people just come back every 3 months, and it just became a printing press of money for the department, and there was no addressing the root cause or anything, and that's $1 billion industry, so.
Yeah. Yeah, you're right. I think the chronic pain in psychology as well as a field has been very much embracing that embodied pain kind of concept, if you like, probably because the cognitive therapies have been tested as therapy for chronic pain and have actually not been successful at all,
Yeah.
to the point where the Cochrane reviews are saying cognitive therapies are contraindicated for chronic pain. And that probably almost forced them to kind of go, all right, well, let's have a look at maybe an embodied pain approach.
Oh yeah, like Bessel van der Kolk, and all that. Of course. But one of my close friends at Duke, who's kind of a rogue psychotherapist, he stumbled across internal family systems on his own. And he has these patients having their dialogue with their different parts, and they get better. And he's a miracle worker.
Yeah. Yeah, and I think there's been a very big embracing of schema therapy, with the parts and things like that as well, which, NLP back in the day was talking about, EMDR talks about, we talk about aspects, So I think you're right. There's a lot of different kind of modalities that are very similar in their approach. They may just use different language around. And is that something, talking about, having conversations with the body part, does that have a place?
I think so. I mean, whenever my shoulder hurt. No, my story though now goes on for another 10 years after my frozen shoulder, and it really every time I attempted to, my pain was gone, but every time I attempted to get my strength back, I would get a flare up of pain afterwards, and I did a lot of work around that. I mean, a lot of other holistic things. I got all my fillings taken out. I had chelation therapy. I did a lot of other, joined a men's group, all these kinds of things that I did. And finally, I guess it was 2016, I was able to start getting my strength back. And now I'm as strong, I haven't been this strong since college when I was a pole vaulter. And I did, I did 90 push-ups this morning, so, if you just told me I could have done that 20 years ago, I said, you're crazy, and so it is possible to heal. I mean, which is amazing for me. And I guess, but now I made friends with my shoulder pain. This is what I encourage all my pain. Say, your shoulder pain is now your biggest ally. It's going to tell you when you're sitting on repressed emotions, and then you get to do something about it. And it's it's a message. Don't shoot the messenger with some medication. Do something about it. So what I usually do is, often I don't know what I'm angry about, and I just start tapping on, my shoulder's really angry, and I don't even know what it is. And then by the end of the tapping, how things kind of emerge, and oh yeah, that's what it is. And then an hour later, my shoulder will be better. And now I do an intense workout, I don't have any pain afterwards. So it's wow, unless I'm sitting on an emotion.
Yeah, that's amazing. And I do think there's such great value, isn't it, in embracing the body and that message and the conversation that, potentially can occur that can give you relief, which is what we're looking for in terms
of guidance, and really guidance. And that's why I've kind of shifted into doing a lot of dream work with my clients too, because it's the same message. It's either coming from your symptom or it's coming from your dream symbol. And it's and Edgar Cayce was the one who said, nothing important happens to us that isn't foreshadowed in our dreams. And so, and if no one's paying attention to their dreams, it's going to show up in your body as a symptom. But if you're really proactive, you'll be keeping a dream diary. And if you got an emotion that's bubbling up from the subconscious, you'll deal with it before it manifests in your body. And that's ideally the way to do it.
Fantastic. So dream journal next to the bed, everybody, and expressive writing when we need to as well. Larry, tell us a little bit about the book that we've got links below, but tell us a little bit about the book and what people can expect to read.
I'll mention one thing about keeping a dream diary, just as a clue, is you want to keep your dream diary by your bedside, and you want to write a question down every night that you want an answer to. It could be about your physical health, but it could be about your job or your relationship. Only one question a night, and any dream you get will be a response to that. And you can sometimes get up to 3 or 4 or more dreams a night. And every 90-minute REM cycle, you get another dream. And always write them down as soon as they occur if you wake up, because you'll not recall them in the morning unless it was a horrifying nightmare. You might remember that. But then, and I do recommend not using a white light. So, and there are these pens you can get on Amazon called Glovio pens, which are red. They're red pens. You just click on them, it turns the red light on, which does not disrupt your pineal function.
Oh, good.
And then you can see to write, and then you just click it off, and you're good. And then you can deal with it the next morning. Some people, if you're thinking by yourself, they use a phone and dictate into your phone, which is great because if you can record that on your computer, you can keep that record on the computer. And then the real advantage of that is you can go back and search it in the future and see, did I have a dream about this? And then you can see if any of them came true. And I just connected with a guy named Carlisle Smith, who's a retired psychologist, sleep therapist in Canada. He's like 10 years older than me, but he wrote a book called Heads Up Dreaming. And he was fascinated by dreams that came true. And he found that, a certain percentage of his dreams, the short ones that weren't some long epic thing, the short ones that had some emotional charge to them often came true. And he discovered, he and his family did it for 30, 40 years since his graduate training. And they discovered they could actually change the outcome, which I think is impressive. It's like,
that lucid,
dreamed about a car accident and, saw that car coming and, that's super cool when that happens. So,
wow, that's amazing.
So
you've got this brand new book out to support people with knowledge and tips around frozen shoulders. Tell us a little bit more about it.
So it's Frozen Shoulder Healing, and then the subtitle is Diagnostic Methods. So how do you find out if you really have a frozen shoulder, and what are the causes and risk factors and things, and then treatment options. So going through everything from emotional approaches to surgical approaches and everything in between. And then I have some case reports at the end of clients that I've worked with, and it's been. Oh, and the key thing about that made the book so much fun is I used Perplexity AI for the first time in my life. Okay?
Amazing.
And I was doing the literature search on all these different topics, and my wife said, "I've been using this for a while. You might want." I was a total AI skeptic. I didn't want to be tainted by AI, and everything. But I asked, tell me if steroids are good for frozen shoulder, and the thing about Perplexity is it gives you half a dozen references, and some of them are directly from PubMed, but other ones are from clinics that use that therapy. So I learned a lot during that process. And so what I decided, since I made the book a PDF, I've had a mainstream publisher once, I've self-published a book once, and then this time I was initially inspired by Carol Look, who originally put out some PDF books a long time ago. And what I really liked about it was you can hyperlink all the references. So I've got 200 references in there. So when you're reading about, acupuncture, you can click on 6 different links and read about how it relates to frozen shoulder. And that was exciting for me. And then I could link to your book, and I could link to everyone else, my blogs and my videos. And wow, so that made it so much fun. And that's why I think people enjoyed reading the book. And they can just download it from larryburk.com or letmagichappen.com, and my websites go to the same place. And it's in my little store, and there's a little banner at the top which tells you how to click on it. So
amazing. We've got all that below, Larry. And I'm going to throw in there too, incredibly low cost. So only $4.99 USD. So absolutely, I did get to read it recently, and I was blown away. I just thought it was so helpful. I had some shoulder things going on, and you're absolutely right. I know what was going on in my life at the time, so I was able to target that. So it had a personal interest to me having a look through it. So
now, do you keep a dream diary, Peta?
I don't, but I do remember my dreams. So I am someone, and I've read your book about dreams, and I've got a couple other dream books on the shelf there. I do remember my dreams. So for quite a while after waking, so I will often ponder, what that was about. Was it symbolic, the theme? I don't physically write it down, but I had a reoccurring dream as a child, and I had it for several years, and I've been able to, as an adult, and certainly in the work we do now, realize what that dream was symbolic about and what was happening for me at the time. So, yeah, and I never had the dream ever since. But
it keeps coming till you get the message. And I also tell people, just in terms of 2 categories of dreams now, terrifying nightmares, they are designed that way to get your attention. It's like, and there's a powerful message, and you got to really, agree to look at it, and And the ones that are super pleasant healing dreams are just like you're on the right path. Keep doing what you're doing. And so either way, the dreams are valuable. But people who are terrified of their nightmares, I'm saying, there's gold in that shadow, and you got to find it.
Yeah, love it. No, it's
But
great.
the scary thing is when I teach psychotherapists EFT, and I ask them how many you keep a dream diary, it's like a pathetic 5%. And I say, didn't you learn anything about Jung or Freud in your training? Oh yeah, wait a week on that, and it's like, oh, okay.
Not a lifetime practice. All right, if any listening in, everybody, if there's one thing you take away, not just about learning more about frozen shoulder and emotions, dream diaries, it's very helpful, and expressive writing, absolutely. There's a little shop here locally that sells these little packs called Write and Release, and
Nice.
they're valuable for young clients that I've worked with over the years, where they can just write out. It could be about some friendship thing that's been happening. They have been incredibly powerful. Sometimes we, burn them, destroy them, shred them.
Yeah.
We've buried them, shredded them with our fingers. Write and release, such a fabulous exercise.
And I think as a take-home message for people, in general, beyond frozen shoulder, is any symptom you have is a message. You want to make friends with it and let it be your ally to guide you to emotional healing. And if you do that, you've got your own built-in biofeedback system. You don't need to go and get hooked up to a monitor and have a machine tell you you're tense. It's like your body's telling you already, just pay attention, and then you'll be aligned with your higher purpose, because your body will keep you on track. And there was a wonderful guy in New Zealand who was one of my mentors too, Brian Broom. I don't know if you've ever connected with him.
No.
He did a series of books on somatic metaphors, and his website is something like Whole Healthcare or something, and he's in Auckland, and I think he might be retired now, but he ran a mind-body clinic for training clinicians how to think that way. And if I ever get over there, I'm going to come visit him and visit you, obviously.
Absolutely. What a wonderful place to wrap this up. Larry, thank you so much for all that you've done in the world, the books that you've contributed. I absolutely recommend everyone. All the links are below, so you can go off and have a look at all of those. And if we can find some of those website links, we'll include them as well. Larry, thank you so much. I look forward to whatever gets kind of, channeled through you next time and where you take your work.
Yes. Thank you, Peta. It's been fun, and we'll see you again soon, I hope.
We will. Thanks, everyone.
Bye.